Have you ever been told that the best thing you can do for poor leg circulation after 60 is simply to walk more? It's good advice, but it's not the whole story. I've met many older adults who faithfully walked every single day. They stayed active, wore compression socks, elevated their legs at night, and still wondered why their feet stayed cold, why their ankles swelled by evening, or why their legs felt heavy after only a short trip to the grocery store. If that sounds familiar, today's video may change the way you think about leg health. Because what many people don't realize is that weak circulation isn't always caused by not walking enough. In many cases, it's because one important muscle gradually stops doing the job it was designed to do. And once that happens, blood can begin lingering in the lower legs instead of efficiently returning to the heart. That slow change doesn't usually happen overnight. It builds quietly over months and years, often without causing enough discomfort to grab your attention until everyday activities become noticeably harder. The encouraging news? Research suggests that one simple movement, when performed correctly and consistently, may help activate your body's natural circulation system far more effectively than most people expect. I'm Dr. Kalvin Stone, and for more than 3 decades I've worked with older adults recovering from vascular problems, orthopedic surgery, and age-related mobility challenges. One lesson has stayed with me throughout my career. The body often responds remarkably well when we understand how it was designed to move. Today, I'll explain why leg circulation changes after 60, why many common approaches only solve part of the problem, and the surgeon-recommended exercise I encourage many suitable patients to learn because it helps the muscles that naturally support healthy blood flow. We'll also go through several simple movements that prepare your legs to perform that exercise safely, along with a few warning signs that should never be ignored because they require prompt medical attention rather than home exercise. But before we get there, you first need to understand one fascinating part of your body that most people have never even heard of. Many doctors call it your second heart. And once you understand why it earned that nickname, the rest of today's video will make perfect sense. Imagine trying to carry several buckets of water upstairs all day long. Eventually gravity wins. Your arms become tired, the buckets feel heavier, and every trip becomes more difficult. Your veins face a similar challenge every second of the day. Blood leaving your heart travels downward through arteries with the help of the heart's pumping action. But once that blood reaches your feet, getting it back up toward your heart is a completely different challenge. Unlike arteries, veins operate under much lower pressure. They must work against gravity. So how does your body accomplish that? It relies on an extraordinary partnership between your calf muscles and tiny one-way valves inside your leg veins. Every time your calf muscles contract, they gently squeeze the deep veins running through your lower legs. That squeeze pushes blood upward. The tiny valves then close behind the blood, preventing it from flowing backward. With every healthy contraction, another small amount of blood continues its journey back toward the heart. It's an elegant system, but like many parts of the body, it changes with age. After about age 60, muscle mass naturally declines unless it's regularly challenged. Veins can become less elastic, and those tiny valves may not seal quite as tightly as they once did. As a result, blood may begin lingering in the lower legs longer than it should. Research has shown that prolonged sitting, reduced physical activity, and age-related muscle loss can all contribute to less efficient venous return. That's one reason some people notice swelling around the ankles by late afternoon. Others complain that their feet always feel cold, even inside warm socks. Some describe aching calves after standing for only a few minutes. Others simply feel that their legs tire much sooner than they used to. These symptoms don't automatically mean something serious is happening. But they also shouldn't be dismissed as just getting older. Because healthy aging and unavoidable aging are not always the same thing. One of my patients, I'll call him Robert, although several patients inspired this story, believed his legs were simply wearing out. At 72, he still walked almost every morning. He rarely skipped a day. Yet by dinner time, his socks left deep marks around his ankles. His calves felt unusually tight. Getting up from his favorite chair required a little more effort every month. Naturally, he assumed he needed to walk even farther. So that's exactly what he did. But nothing really changed. In fact, by trying to walk longer with muscles that weren't working efficiently, he often finished his walks feeling more fatigued than refreshed. The turning point came when we stopped focusing only on distance and started paying attention to how his muscles were working. That small shift completely changed our approach. And surprisingly, the first exercise I recommended wasn't even walking. It was something much simpler. Something designed to wake up the muscles responsible for pumping blood back toward the heart. Before I show you that progression, though, there's another misunderstanding I want to clear up.
Many people believe circulation problems always begin inside the blood vessels. Sometimes that's true. Conditions such as peripheral artery disease, diabetes, heart disease, or chronic vein disorders certainly deserve medical evaluation and treatment. But sometimes the muscles surrounding those blood vessels have quietly become weaker than the blood vessels themselves. Think of it this way. If you own a garden hose, but the pump connected to it becomes weaker every year, replacing the hose won't completely solve the problem. The pump also needs attention. Your calf muscles work much the same way, which brings us to the first movement I recommend, because it gently wakes up that natural pumping system without placing excessive stress on aging joints. And once you see how incredibly simple it is, you'll understand why so many surgeons and rehabilitation specialists begin here. The first movement isn't impressive demanding exercises. In fact, if someone walked into the room while you were doing it, they might wonder how something so small could possibly help your circulation. But that's exactly why so many people overlook it. It's called the ankle pump. And despite its simplicity, rehabilitation specialists often introduce it very early after certain surgeries, because it encourages the calf muscles to contract gently while a person is still sitting or lying down. Here's why it matters. Remember the second heart we talked about a moment ago? Every time you pull your toes upward and then slowly point them downward, your calf muscles tighten and relax. That repeated contraction gently squeezes the veins inside your lower leg, helping move blood upward instead of allowing it to linger around your ankles. Think of it as pressing and releasing a sponge filled with water. Each squeeze pushes a little more fluid out. Your calf muscles do something remarkably similar with blood inside your veins. If you've spent several hours watching television, reading, driving, or sitting at a computer, your calf muscles may have been almost completely inactive during that time. The longer they remain inactive, the less assistance they provide to your circulation. That doesn't mean sitting is dangerous by itself. It simply reminds us that our muscles were designed to contract regularly throughout the day. The good news is that it doesn't take an exhausting workout to remind them how. Here's how to perform an ankle pump safely. Sit comfortably in a sturdy chair with both feet resting flat on the floor. Slowly lift your toes toward your shins while keeping your heels on the ground. Pause for just a second, then gently point your toes downward as you lift your heels slightly. Move slowly. Don't rush. One complete up and down motion counts as one repetition. Start with about 15 to 20 repetitions. If that feels comfortable, repeat the exercise 2 or 3 times during the day. Perhaps while enjoying your morning coffee, watching the evening news, or talking with family. Many people are surprised that something requiring so little effort can leave their legs feeling lighter afterward. That's because consistency often matters more than intensity. Rather than asking your muscles to work extremely hard once a week, you're encouraging them to do the job they were naturally designed to perform many times each day. But here's something equally important. Ankle pumps are an excellent place to begin. They are not the finish line. They wake the circulation system up. They don't fully strengthen it. To do that, we need to involve larger muscles higher up the leg, and that's where many people begin noticing meaningful improvements in confidence and everyday movement. The next exercise may look familiar because physical therapists have recommended variations of it for years. It's called the seated leg extension. Unlike the ankle pump, this movement asks the large muscles on the front of your thigh, the quadriceps, to become active. Those muscles do much more than help you stand. Every time they contract, they also influence blood flow through the upper portion of your leg. As we grow older, one of the biggest challenges isn't simply circulation, it's muscle loss. Beginning around midlife, Adults naturally lose muscle mass unless they continue challenging those muscles through regular activity or strength training. That gradual loss can make climbing stairs harder. Standing from a chair takes more effort. Walking becomes slower. Balance becomes less reliable. Many people blame aging itself, but often, part of the issue is that muscles have quietly become weaker. Fortunately, muscles remain surprisingly adaptable well into older adulthood. Research consistently shows that older adults can improve strength, mobility, and functional independence with appropriately designed exercise programs. That's encouraging because stronger muscles don't just help you move, they help you keep moving. Here's how to perform the seated leg extension. Sit toward the back of a sturdy chair with your back supported. Keep both feet flat on the floor. Slowly straighten one knee until your leg is almost parallel with the floor, or only as high as feels comfortable. Hold the position for about 2 seconds. Then lower your foot slowly back to the floor. Avoid letting gravity do the work. The lowering phase is just as valuable as the lifting phase. Complete 10 to 12 repetitions before switching legs. If this becomes easy after several weeks, your healthcare provider or physical therapist may recommend adding light ankle weights or a resistance band. Small increases in resistance often provide enough challenge to keep muscles improving without overstressing the joints. One detail many people overlook is posture. Try not to lean backward or swing your upper body. Keep your movements smooth and controlled. Quality matters far more than speed. One well-controlled repetition teaches your muscles much more than several rushed ones. I often tell patients to imagine they're moving through thick honey, slow, steady, purposeful. Those are the movements your muscles respond to best. But while stronger thighs improve walking and standing, they don't completely solve another problem that becomes increasingly important after age 60: balance. Because good circulation means very little if you're afraid to stay active, and once fear of falling begins limiting movement, circulation can decline even further. That creates a cycle many older adults don't realize they're trapped in. Move less. Muscles weaken, balance declines. Activity decreases again. Circulation becomes less efficient. The encouraging part is that this cycle can often be interrupted, and the next exercise does exactly that by combining circulation, muscle activation, and balance into one simple movement. More importantly, it begins preparing your body for the surgeon-recommended exercise you've been waiting to see since the beginning of this video. And that's where things become even more interesting. Let's talk about the exercise that often surprises people the most. Not because it's difficult, but because something so simple can challenge several important systems in your body at the same time. It's called the supported calf raise. At first glance, it may look like nothing more than standing on your tiptoes. But underneath the surface, something much more important is happening. Every time you slowly rise onto the balls of your feet, your calf muscles contract powerfully. That contraction compresses the deep veins running through your lower legs, helping push blood upward toward your heart. Then, as you slowly lower your heels back down, those muscles relax, allowing fresh blood to circulate through the tissues before the next contraction begins. It's a natural pumping cycle your body has relied on for decades. The difference is that after 60, many people stop challenging those muscles enough to keep them strong. The result isn't just weaker legs. It benefits the heart, lungs, brain, mood, and overall health. But walking spreads the workload across dozens of muscles. The calf muscles contract for only brief moments before relaxing again. A slow, controlled calf raise intentionally asks those muscles to work much harder than they usually do during an ordinary walk. Think of it like carrying groceries. Walking is similar to making several trips with light bags. A calf raise is like briefly picking up one heavier bag with good technique. It can also mean less efficient circulation, reduced ankle stability, and a greater fear of losing balance. That's why this exercise appears in so many rehabilitation and healthy aging programs. It isn't only about blood flow. It's about preserving independence. One of the questions patients often ask me is, "Doctor, if I already walk every day, why would I need this?" It's an excellent question. Walking is one of the healthiest activities most older adults can do. Slowly rise onto the balls of your feet, as high as feels comfortable. Don't rush to the top. Move smoothly. Pause for 1 or 2 seconds, then lower your heels slowly back to the floor, over about 3 seconds. That slow lowering phase is extremely important. It challenges the muscles differently than lifting alone and helps improve control. Begin with 8 to 10 repetitions. If that feels easy after a couple of weeks, gradually increase toward 15 or even 20 repetitions. The focused effort encourages your muscles to become stronger. And stronger muscles generally become better at doing the work they were designed to perform. Here's how to perform a supported calf raise safely. Stand behind a sturdy chair or next to a kitchen counter. Rest your fingertips lightly on the surface for balance. Your hands are there for confidence, not to hold up your weight. Place your feet about hip-width apart, always staying within your comfort level. If you experience sharp pain, dizziness, or feel unstable, stop the exercise and speak with your healthcare provider before continuing. Remember, the goal isn't exhaustion. The goal is consistency. A few careful repetitions performed several days each week are usually far more beneficial than doing too much all at once. One mistake I see fairly often is using momentum. Every time you rise onto your toes, your brain receives information from your feet, ankles, knees, hips, eyes, and inner ear. Within fractions of a second, your nervous system makes tiny adjustments to keep you upright. You don't even notice them, but your brain does. Those small corrections become incredibly important as we age. Why? Because balance isn't something that suddenly disappears one day. It gradually becomes less precise if it isn't challenged. People bounce up quickly and drop back down. That turns the movement into something completely different. Instead, imagine an elevator. It rises smoothly. It pauses. Then it returns just as smoothly. That's the rhythm you're looking for. Now here's something many people don't expect. This exercise isn't only strengthening your calves. It's quietly training your balance as well. And when balance declines, confidence often declines right along with it. People begin avoiding walks. They hesitate before climbing stairs. They stop visiting friends because they're worried about falling. Without realizing it, they begin moving less. Unfortunately, moving less can contribute to weaker muscles and less efficient circulation. It's a cycle that feeds itself. But the opposite is also true. When muscles become stronger and balance improves, many people naturally become more active again. They walk farther, stand longer, feel steadier. That increased movement creates even more opportunities for healthy circulation throughout the day. One improvement supports another. This is why surgeons, physical therapists, and rehabilitation specialists rarely focus on circulation alone. They look at the entire picture: strength, mobility, confidence, balance, endurance. All of these pieces work together. And before we move on, I want to share one important reminder. If one leg suddenly becomes swollen, painful, unusually warm, or changes color, don't assume it's simply poor circulation or something exercise can fix. Those symptoms deserve prompt medical evaluation because they can sometimes signal a condition that requires immediate treatment. Likewise, if you develop chest pain, sudden shortness of breath, or severe pain while exercising, stop immediately and seek medical care. Exercise is an excellent tool for many people, but it's never a substitute for proper medical diagnosis when warning signs appear. Now that we've strengthened the calf muscles and started improving balance, we're ready for the next step. This movement challenges your body in a completely different way. Instead of asking your muscles to contract briefly, it asks them to stay engaged continuously. That sustained effort is exactly what makes the final surgeon-recommended exercise so effective for many older adults. And once you experience the difference between a quick contraction and a controlled hold, you'll understand why so many rehabilitation programs save this technique for last. Now we've reached the movement I wanted to save for last. Not because it's the hardest, not because it's the newest, and certainly not because it's a miracle. I saved it because once you understand everything we've covered so far, the calf muscle, the body's natural pumping system, and the importance of strength, you'll finally understand why this exercise is recommended by so many surgeons and rehabilitation specialists. Think of squeezing a sponge. If you squeeze it quickly and let go immediately, some water comes out, but if you maintain that squeeze for a few moments, even more water is pushed through before you release it. Your calf muscles behave in a surprisingly similar way. Holding the contraction allows those muscles to continue assisting blood as it travels upward toward your heart. It is called the standing calf pump hold. At first glance, it looks almost identical to the calf raise you just learned. But there's one small difference that changes everything: the hold. Instead of immediately lowering your heels after rising onto your toes, you stay at the top for several seconds. That brief pause keeps your calf muscles fully engaged, maintaining gentle pressure on the deep veins inside your lower legs for a little longer. Healthy circulation depends on many factors, including heart health, healthy arteries and veins, regular physical activity, proper management of conditions like diabetes or high blood pressure, staying hydrated, and avoiding tobacco. The standing calf pump hold isn't a magic solution. It's one valuable tool that supports the muscles responsible for helping blood return from your legs. And for many older adults, that support can make everyday movement feel easier over time. Here's how to perform it safely. Stand behind a sturdy kitchen counter or a heavy chair. Place both hands lightly on the surface for balance. Keep your feet about hip-width apart. Slowly rise onto the balls of your feet until your heels are comfortably elevated. Now comes the important part. Instead of lowering immediately, hold that position for 3 to 5 seconds. Continue breathing normally. Don't hold your breath. Keep your shoulders relaxed. Look straight ahead instead of down at your feet. When the hold is complete, lower your heels slowly over about 3 seconds. That's 1 repetition. Begin with 8 repetitions. As your strength improves over several weeks, gradually work toward 15 repetitions if your healthcare provider agrees it's appropriate for you. There's no prize for finishing quickly. Slow, controlled movement produces much better results than rushing through the exercise. In fact, if your calf muscles begin feeling slightly tired by the last few repetitions, that's usually a sign they're finally being asked to do meaningful work, not painful work, productive work. One question I hear often is, how long before I notice a difference? The honest answer is that everyone responds differently. Some people report their legs feel lighter after only a week or 2 of practicing these movements consistently. Others notice they're standing longer before their legs begin feeling tired. Some tell me their evening ankle swelling gradually becomes less noticeable. Others simply feel more confident walking around the neighborhood. These are encouraging improvements, but they usually happen because several healthy habits are working together, not because of one exercise alone. Every hour, she stood for a minute or 2. She practiced ankle pumps while reading. She performed seated leg extensions before lunch, and each morning, after making coffee, she completed a short series of supported calf raises, followed by standing calf pump holds. Several weeks later, she smiled and said something I'll never forget. "Doctor, I don't think about my legs nearly as much anymore." That wasn't because she'd become 20 years younger. She assumed it was just part of aging. When we evaluated her routine, something stood out immediately. She spent nearly 6 hours each day sitting between breakfast and dinner, reading, watching television, doing crossword puzzles. None of those activities were harmful, but together they meant her calf muscles remained inactive for long stretches. Rather than asking Margaret to completely change her lifestyle, We made a few simple adjustments. That's an important distinction. Real progress is often gradual, and gradual progress tends to last. I remember another patient. Let's call her Margaret. She was 76, loved gardening, and refused to believe anything was wrong with her legs. She simply thought she was slowing down. Every afternoon, however, she found herself cutting her gardening sessions shorter. Her calves felt heavy. Her ankles looked swollen by sunset, and that's exactly why this final exercise matters. It doesn't just strengthen a muscle. It supports the confidence that helps people stay active, and staying active remains one of the most powerful investments you can make in healthy aging. Before we finish, though, there's one final message every older adult needs to hear. There are times when exercises, even excellent ones, are not the right answer. In the final part, I'll explain the warning signs that should never be ignored, how to combine all of these movements into a simple daily routine that takes only a few minutes, and the one habit that quietly undermines circulation. Even if you exercise every single day, it was because everyday movement had started feeling natural again. For many older adults, that's the real goal. Not perfection, freedom. Freedom to walk through the grocery store without constantly searching for a place to sit. Freedom to enjoy time with grandchildren without worrying your legs will give out halfway through the afternoon. Freedom to take an evening walk because you want to, not because you're forcing yourself. Before we wrap up, I want to leave you with something even more important than any single exercise: knowing when exercise is helpful and when it's time to call a doctor. Most circulation changes that develop gradually over months or years can often be managed with a combination of healthy lifestyle habits, appropriate exercise, and medical care when needed. But some symptoms should never be ignored. If you suddenly develop severe pain in one leg, if one foot becomes pale, bluish, or unusually cold compared with the other, if you notice rapid swelling in only one leg, especially when it's accompanied by warmth, redness, or tenderness, or if you develop a sore on your foot or lower leg that refuses to heal, don't try to exercise through it. Those symptoms deserve prompt medical evaluation because they may indicate a condition that requires treatment, not more movement. Likewise, if walking causes severe calf pain that consistently disappears with rest, or if your symptoms are getting worse despite staying active, schedule an appointment with your healthcare provider. Simple tests can often identify circulation problems early, giving you more treatment options before they become serious. Remember, the goal isn't to diagnose yourself. The goal is to recognize when your body is asking for professional help. Let's put everything you've learned today into one simple routine. Many viewers expect complicated programs with expensive equipment. Fortunately, that's not necessary. For many older adults, a routine like this can be a practical place to begin after discussing it with their healthcare provider. Step 1. Start your morning with 20 ankle pumps on each foot while sitting comfortably. This gently wakes up your calf muscles after a night's sleep. Step 2. Perform 10 to 12 seated leg extensions on each leg using slow, controlled movements. Focus on good posture instead of speed. Step 3. Stand behind a sturdy chair and complete 10 supported calf raises. Pause briefly at the top and lower yourself slowly. Step 4. Finish with 8 to 10 standing calf pump holds, maintaining each hold for 3 to 5 seconds while breathing normally. The entire routine takes only about 10 to 12 minutes. You don't need a gym. You don't need expensive equipment. You simply need consistency. Because the truth is, your circulation doesn't respond to what you do once. It responds to what you do repeatedly. That's how muscles become stronger. That's how balance improves. And that's how many healthy habits gradually begin working together. There's one more habit, however, that quietly cancels out much of that good work. Sitting for long, uninterrupted periods. This surprises many people because they exercise every morning. They complete their walk. They finish their routine. Then they spend the next 6 or 7 hours sitting almost continuously. Our bodies weren't designed for that. Even if you exercise regularly, prolonged sitting can reduce muscle activity throughout the day. The solution isn't standing all day. It's simply breaking up long periods of sitting. Try standing every 30 to 60 minutes. Walk to the kitchen for a glass of water. March gently in place for a minute. Perform a few ankle pumps while reading. Take a short walk around the house after meals, if it's safe for you. These tiny movement breaks may seem insignificant, but over weeks and months, they add up. Think of your circulation like a stream. When water keeps moving, it stays fresh. Progress didn't happen overnight. It happened one day at a time, one repetition at a time, one healthy decision at a time. And that's encouraging because it means there's often something meaningful you can do starting today. If this video helped you better understand how your legs support healthy circulation, I'd love to know in the comments. That's unavoidable. But many of those changes respond remarkably well to regular movement, appropriate strength training, and healthy daily habits. The body is far more adaptable than many people realize. I've seen older adults in their 70s and 80s regain confidence they thought was gone forever, not because they found a miracle treatment, but because they stayed consistent with simple, evidence-based habits. When it sits still for too long, problems begin to develop. Your muscles help keep that stream moving. And every time you use them, you're giving your body another opportunity to support healthy circulation. As we finish today, I want you to remember one important message. Growing older doesn't automatically mean accepting weak legs, poor balance, or constant swelling as your new normal. Yes, aging changes the body, and if you enjoy practical, evidence-based health information designed specifically for adults over 60, be sure to subscribe and turn on notifications so you don't miss future videos. We'll continue exploring simple ways to protect your mobility, improve your strength, and stay independent for as long as possible. Until next time, take care of your legs. Which exercise are you going to try first? Was it the ankle pumps, the seated leg extensions, the supported calf raises, or the standing calf pump hold? Your experience may encourage someone else who's reading the comments and wondering where to begin. Always consult your physician or another qualified healthcare professional before beginning a new exercise program, especially if you have heart disease, peripheral artery disease, diabetes, recent surgery, severe joint pain, or any other medical condition. If you experience sudden leg pain, chest pain, shortness of breath, or other emergency symptoms, seek immediate medical care. They've carried you through every chapter of your life. With a little daily attention, they'll be ready to carry you through many more. Medical disclaimer: this video is for educational purposes only and is not a substitute for personalized medical advice, diagnosis, or treatment.